All right, greetings. Now, from the jump, let's lay it down how it is. The next several episodes are going to be some of the most informational, educational, and dry readings that may ever happen on this show within the next 6 to 12 months. Why is this? Because I caught on Twitter a tweet from Ottawa Public Health. What was that tweet? I forgot exactly what it said, but it said the recently published Status of Mental Health in Ottawa report. And I said to myself, now we have something very informational here. Let's see what this is about. And I guess on June 2nd, between June 2nd and 6th, if I'm not mistaken. I know that's a wide range, but I literally just caught it, and I was digging through the report here. I have it here, PDF, on the phone. And I've gone through it. It's 129 pages, but I'm going to be narrating everything except the charts and data. Anything that appears in a graph, you're obviously not going to hear me say that. It's kind of hard to narrate, graphs and charts, obviously. So, Status of Mental Health in Ottawa, Report 2018, published by Ottawa Public Health. Message from Ottawa Public Health. On behalf of Ottawa Public Health, OPH, first of all, this is written by Dr. Vera Etches, MD, CCFP, MHSC, FRCPC, Medical Officer of Health. So, message from Ottawa Public Health. On behalf of Ottawa Public Health, OPH, I am pleased to provide the Status of Mental Health in Ottawa report, which is the first local surveillance report to describe the state of mental health across the population of Ottawa. I am grateful to the Champlain Local Health Integration Network, the members of our Mental Health Advisory Committee, the Public Health Agency of Canada, and the many OPH staff for their support and expertise in developing this report. With the important focus on mental health in our community, this report is timely and relevant as it highlights the factors that promote and protect mental health and those that contribute to poor mental health. This information builds on the current work to promote mental health by community partners, service delivery agencies, and OPH. The findings from this report will also help to inform future discussions on mental health promotion and will support policymakers, community partners, and our own endeavors to promote positive mental health. Now, next chapter here. So there's some acronyms. And it's good that we stumble into the acronyms page because I am going to be short, cutting down on certain words like information will immediately be info, for example, just to make this easier to read. But I'm going to be recording this whole session of narrating this report over multiple episodes. And if you've noticed, I've kind of slipped away from the format of 23 minutes and 16 seconds. That's coming back for this particular report narration. Okay, acronyms. CAMH, Center for Addiction and Mental Health. CCHS, Canadian Community Health Survey. DAD, Discharge Abstract Database. ED, Emergency Department. EDI, Early Development Instrument. LGBTQ2, lesbian, gay, bisexual, trans, queer, two-spirited. LHIN, Local Health Integration Network. NACRS, National Ambulatory Care Reporting System. OHIP, we should know that, Ontario Health Insurance Plan. ONS, Ottawa Neighborhood Study. OPH, Ottawa Public Health. OSDU HS, Ontario Student Drug Use and Health Survey. PHAC, Public Health Agency of Canada. Okay, executive summary. The status of mental health in Ottawa report describes the mental health of Ottawa residents, including the characteristics and factors that promote mental health in our community, and the number of residents seeking care for mental illness and addictions. In order to understand the mental health status of a community, it is necessary to use a population-based model of health. This report uses the Public Health Agency of Canada's Positive Mental Health Surveillance Conceptual Framework to report on the determinants of mental health at a local level. As part of OPH's strategic direction to foster mental health in our community, OPH is committed to increasing mental health promotion efforts at the population level across the lifespan. Alongside our many community partners, OPH seeks to contribute to A, the improved well-being of the population, B, supportive environments that enhance mental health where residents live, learn, play, and work, and C, the improved quality and accessibility of services for individuals with mental health issues and their caregivers. So, what is the purpose of the report? The status of mental health in the Ottawa report was written in collaboration with mental health experts and community partners. It aims to assess the mental health of Ottawa residents, to understand the characteristics and factors that promote mental health in our community, and to support all residents to have a better understanding of the factors that influence mental health. This report will provide only a snapshot of mental health care utilization in Ottawa. This report describes the current state of mental health in Ottawa, including the number of residents living with mental illness and substance use disorders, identifies factors that influence mental health outcomes in Ottawa, and informs programming, services, and policies that aim to improve mental health of residents and foster a resilient community. Why talk about mental health? The World Health Organization defines mental health as, quote-unquote, a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Mental health and mental illness are distinct, as mental health refers to the spectrum of emotions, thoughts, and feelings that everyone experiences, whereas mental illness is a diagnosed disorder that affects the way a person thinks, feels, and/or behaves. Poor mental health may sometimes lead to mental illness, as poor physical health can lead to physical illness such as heart disease and diabetes, but not all those with poor mental health suffer from a mental illness, nor do all those with a mental illness have poor mental health. The state of individual mental health has a significant impact on how a person will live, learn, work, and play throughout their lives. Positive mental health begins in pregnancy as the brain's architecture is developed and continues through the lifespan as a person interacts with their environment and forms relationships. Positive mental health is associated with better overall health, resilience, and the ability to cope with life's challenges. It is a protective factor against suicidal behavior, poor academic performance, and depression. Positive mental health is also a protective factor against problematic substance use and reduces the burden of other significant health issues. Positive mental health reduces stroke incidence and improves survival rates, reduces heart disease, and lowers the number of chronic diseases overall. In contrast, poor mental health impacts the quality of life and well-being of individuals, families, communities, and society. It can also lead to mental illness and risk-taking behaviors, including substance use, problem gambling, and risky sexual practices. Here are some examples of how mental illness affects Canadians. 1 in 5 Canadians are affected by mental illness annually. The burden of mental illness and addictions in Ontario is more than 1.5 times that of all cancers. 23% of Canadian parents care for children with mental illness. In 2015, 4,405 deaths by suicide occurred in Canada. The estimated cost for Canadians for mental illness was $50 billion in 2011. Healthcare, social services, and income support costs make up the biggest proportion of these costs. It has also cost businesses more than $6 billion in lost productivity from absenteeism and turnover. Positive mental health promotion across the population is a key part of fostering and maintaining a healthy and resilient community. It is also integral in preventing the onset of worsening of mental illness and problematic substance use and enhancing recovery from illness. The Public Health Agency of Canada's Positive Mental Health Surveillance Conceptual Framework. To understand the mental health status of a community, it's necessary to use a population-based model of health. This report uses the Public Health Agency of Canada's, the PHAC, Positive Mental Health Surveillance Conceptual Framework to report on mental health outcomes and determinant indicators. Indicators where data were unavailable are not included in this report. PHAC developed this framework through an iterative consultation process to ensure the information was relevant and actionable to influence change in public health policy and practice, and that indicators were evidence-based, accessible, and could be collected regularly to monitor trends over time. This population approach framework identifies factors that influence mental health outcomes, including individual characteristics like physical health, resilience, and coping skills, and environmental characteristics, including family, community, and the larger societal environments where mental health is impacted by economics, societal norms, access to services, and urban design. The PHAC's Positive Mental Health Surveillance Conceptual Framework is used nationally to inform programs and policies that improve the mental health status of Canadians throughout the life course. Now, so there's a figure here, figure 1, which is a picture infographic. Public Health Agency of Canada's Positive Mental Health Surveillance Conceptual Framework. The best way to describe this is that there are overlapping categories. So here we go. Positive mental health. Self-rated mental health, happiness, life satisfaction, psychological well-being, and social well-being. So under individual, there is resiliency, control, coping, violence, health status, physical activity, nurturing childhood, substance abuse, and spirituality. Under family, we have relationships, parenting style, health status, household composition, income, substance abuse. Under community, we got community involvement, social networks, social support, school, workplace, neighborhood, social, and built environment. Under society, we got inequality, political participation, discrimination, and stigma. So the source for this infographic was Center for Chronic Disease Prevention, 2016, Positive Mental Health Surveillance Conceptual Framework, infographic, Canada, 2016. Methodology. How much time we got here? Okay, methodology. Data sources. Many data sources were used to report on the mental health of Ottawa residents using indicators from PHAC's Positive Mental Health Surveillance Conceptual Framework. Local sources of data include survey data such as the Ontario Student Drug Use and Health Survey, OSDAUHS, Canadian Community Health Survey, the CCHS, the Early Developmental Instruments, EDI, the My Life, My Wellbeing study, death data from the Ontario Coroner or the Vital Statistics Registry, emergency department and hospitalization data, data from the Ottawa Neighborhood Study, the census data. Where local data were out of date prior to 2012 or unavailable, provincial or national sources of data were used. These data sources included Stats Canada, CCHS Mental Health Survey, General Social Survey, Aboriginal Peoples Survey, and the Ontario Incidence Study of Reported Child Abuse and Neglect. Analysis. Data from the CCHS were analyzed using Stata SE14. That's from StataCorp, College Station, Texas, with methods recommended by Stats Canada. Socioeconomic variables assessed included sex, age group, mother tongue, highest level of education, household income level, time since immigration, location of residence, and that's population center or rural, household composition, home ownership, employment status in the past week, and Indigenous identity. All right, so we're gonna continue on in the next episode with the rest of the methodology. We're running out of time here, so thanks for listening to this. This is heavy, but it's definitely worth reading. And if you're not going to read, I'm making this an audio format for you. Clearly. All right, peace.